leading better value care as a conduit to bring evidence-based care to all of our communities and all our acute health services. Murrumbidgee was one of the 2 highest levels of amputation across the state in healthcare services, and it was really important for us to be able to deliver evidence-based care to these people to reduce the level of amputations.
Some of the key challenges were bringing together all the relevant key players and developing our model of care. And that person-centred approach really helps us with our holistic assessment of the patient. And I think it provides a one-stop shop for, public podiatry services, wound care, optimising their diabetes, and looking at the cultural aspect of care, particularly for our Aboriginal clients.
And the patient gets referred to the clinic and they receive the care that's required.
So our high-risk foot clinic is one of the early adopters of the patient-reported outcome measures.
My GP referred me to Dr. Airy, vascular surgeon, and he referred me to the foot clinic. So Bromans just looked at him and took me straight over to emergency. They told me that I was going to lose a foot. I didn't want to know anything about it. I was ready to get up and walk out of the hospital and just never look back.
The number of young people that were in there with the amputations was a real eye-opener. It started off with a blister on my heel. It got infected and ended up having to have an operation in hospital here. They got me into the foot clinic and had community nurses coming 3 times a week.
You cannot have a program to provide healthcare on a scale like this if it's fragmented. It's about consistency. It's a collaboration between us and patients must take responsibility but also be empowered to participate in their own health. And there are some patients that are really engaged and they're really proud of the work they do, as they should be, and they benefit by being healthy at home instead of being unwell in hospital.
If you want to stay mobile and healthy, well, self-discipline, I think, is the biggest thing, I think. The other option doesn't seem very tasteful for it to let it get worse and, possibly lose a foot. Or
if the foot clinic wasn't here, I don't know where I'd go. This has been a godsend.